During pregnancy, the cervix stays firm, long, and completely closed. You can imagine it like a tightly shut door that keeps your baby protected inside the uterus. When labor begins, this door slowly starts to open. This opening is called cervical dilatation. Cervical dilatation is measured in centimeters from 0 to 10. 0 centimeters means the cervix is fully closed, and 10 centimeters means it is completely open and ready for the baby to pass through. 10 centimeters is what we call fully dilated. Doctors and midwives measure dilation by doing a gentle vaginal examination using 2 fingers. They feel how wide the cervix has opened. This isn't an exact measurement like using a ruler, but it gives a good idea of how much progress your body is making. This is always done by a trained professional and only when needed. To help you imagine the size, many people use simple comparisons. Around 2 centimeters can be thought of like a small coin. Around 4 centimeters is roughly the size of an Oreo. 6 centimeters is similar to the size of a small soda can, and 10 centimeters is about the size of a bagel. These are just fun ways to picture the size. Every woman's body is different, so these are only rough comparisons. During labor, contractions play the biggest role in opening the cervix. With each contraction, the baby is gently pushed downward. This pressure helps the cervix thin out and open more and more. In early labor, dilation is usually slow. As you move into active labor, it tends to speed up. The first stage of labor is the entire process of your cervix opening from 0 to 10 centimeters. Early labor covers the beginning part, usually up to about 5 centimeters. Active labor starts around 6 centimeters and continues until you are fully dilated. After that, you enter the pushing stage, when your baby is ready to come out. Then, the placenta is delivered, and finally, the first hour after birth is considered the 4th stage, when your body begins recovering. You may notice signs that your cervix is starting to open. One of the first signs can be the mucus plug coming out. This is a thick piece of mucus that seals the cervix during pregnancy. You might also see a bloody show, which is pink, red, or brown discharge. Contractions usually become stronger and more regular as dilation increases. Sometimes your water breaks during this time. Labor pain happens because the uterus is working extremely hard and the cervix is stretching. This can feel similar to menstrual cramps at first, but becomes stronger as labor progresses. Pain levels vary from person to person, and there are many safe pain relief options available. The speed at which a cervix dilates is different for every woman. Some dilate very quickly, while others take more time. Factors like whether this is your first baby, the baby's position, the baby's size, the shape of your pelvis, and the strength of your contractions can all influence how fast dilation happens. There is no single normal speed. Every labor is unique. When the cervix reaches 10 centimeters, it is fully open. The baby's head usually moves low into the birth canal, and many women naturally feel an urge to push. This is the stage where your body is ready to bring your baby into the world. You should go to the hospital or call your provider if your contractions become regular, 3 to 5 minutes apart. If your water breaks, if you have heavy bleeding, if your baby's movements change noticeably, or anytime something just doesn't feel right. It is always better to get checked early than to wait too long. Remember, cervical dilatation is a natural and gradual process. Your body knows exactly what to do. Every woman's labor is different, so try not to compare your experience with others. Stay calm, trust your body, and keep communicating with your healthcare provider. You are stronger than you think, and your body is beautifully designed for this journey.